Welcome to our video on Arcoxia, a medication that offers relief from various types of pain. Today, we'll cover what is Arcoxia, its uses and dosage guidelines, how to use it properly, and its potential side effects. Arcoxia contains the active ingredient etoricoxib. It's a medication used to manage pain and inflammation associated with several conditions, including osteoarthritis, rheumatoid arthritis, gout, ankylosing spondylitis, an inflammatory disease affecting the spine and large joints, and for the pain of muscle and bones. Arcoxia has the benefit to other painkillers, as it poses a lower risk of causing stomach ulcers. Let's see how to use this tablet. Arcoxia comes in the following tablet strengths: 30 mg, 60 mg, 90 mg, and 120 mg. Here's a guide on how to use it for various conditions. For osteoarthritis, take 30 mg or 60 mg once daily. For rheumatoid arthritis, the recommended dose is 90 mg once daily. For ankylosing spondylitis, use 90 mg once daily. For gout attacks, take 120 mg once daily, but use up to 8 days. Other acute and chronic muscle pain, the dose is typically 60 mg once daily. Arcoxia can be taken with or without food. Swallow the tablets whole with a glass of water, do not split them. Try to take your medication at the same time each day for consistency. Note: for osteoarthritis and rheumatoid arthritis, Arcoxia helps to relieve symptoms, but does not cure these conditions. Potential side effects for this tablet include stomach pain, wheezing or shortness of breath, swelling of the legs and/or feet, dizziness, headache, increased blood pressure. If you have any question or suggestion, just drop below, we will answer that.